The Senior Protection and Care Act has officially moved forward. Here's what older Americans across the country should understand immediately. Pause whatever you are handling right now, because the information you are about to hear could potentially return hundreds or even thousands of dollars to your finances this year alone. A sweeping new law has recently advanced through the United States Senate, and if you are over 60 years old or if someone close to you is, including a parent, grandparent, or another family member, these changes directly involve you. We are discussing retirement benefits, medication expenses, Social Security payments, nursing home standards, and safeguards designed to protect the savings you spent decades earning. Here is the detail that very few people are mentioning publicly. Not every advantage included in this legislation happens automatically. Certain benefits only begin if you personally respond. Some come with strict deadlines, while others require updated records with government agencies before important enrollment periods expire. Ignore those steps, and you could lose access to valuable financial support. It truly is that straightforward. In today's video, we are going through every major update included in the Senior Protection and Care Act using clear, everyday language. No confusing legal terminology, no political talking points, and no unnecessary complications, only the essential details your family needs so you understand exactly what benefits may now be available, what rules have changed, and what actions you should take next to secure your future. Stay with me all the way to the end because the most critical steps you need to follow are coming later in this video, and missing them could cost you. Let's begin with why this legislation was introduced in the first place and the background that explains its importance. For many years, older Americans have quietly struggled within a system that was never truly designed around their needs. Prescription medication prices continued climbing to unreasonable levels. Nursing homes operated with limited oversight and accountability. Cost of living increases failed to keep up with the actual monthly expenses retirees faced. On top of that, financial scams targeting older citizens kept growing, stealing the retirement savings hard-working people spent entire lifetimes building. These were never small inconveniences or isolated problems. They became major crises affecting millions of households throughout the United States. Yet lawmakers often treated these concerns as secondary issues for decades. The Senior Protection and Care Act represents one of the broadest pieces of legislation focused on older Americans past in many years. It reaches nearly every part of life that becomes especially important after age 60, including healthcare, housing, financial security, mental wellness, caregiver assistance, and personal protection. And the reason we are taking the time to explain all of this carefully is simple. News headlines move quickly, stories appear and disappear every day. But the practical details, the parts that actually influence your health, your money, and your daily quality of life, rarely receive the attention they deserve. That changes right now. First, let's discuss prescription medication reform and the possibility of meaningful savings at the pharmacy. This section of the bill is considered one of its biggest victories, and many people believe it should have happened years ago. For a very long time, Medicare was legally blocked from negotiating prescription drug prices directly with pharmaceutical corporations. Think about how unbelievable that sounds. The single largest buyer of prescription medications in the United States could not use its enormous purchasing power to lower costs. Private insurance companies had the ability to negotiate. Veterans Affairs could negotiate prices. Yet Medicare, which serves more than 65 million Americans, was prevented from doing the same. Because of that restriction, seniors in the United States frequently paid some of the highest prescription drug prices anywhere in the world, even for medications that people in countries like Canada, Germany, and Japan purchased at much lower prices. The Senior Protection and Care Act broadens and speeds up that reform effort. Under the updated rules, Medicare now has authority to negotiate costs for a much wider range of medications, and the reduced prices are expected to begin sooner than originally planned. What does this actually mean for everyday people? If you currently spend $200, $300, or even $500 every month for prescriptions related to diabetes, heart conditions, arthritis, or blood pressure treatment, there is a strong possibility those expenses could begin decreasing soon instead of years from now. The rollout is beginning immediately on a phased schedule. The legislation also places a yearly cap on out-of-pocket prescription costs for Medicare recipients. In plain English, there is now a maximum limit on the amount you can personally spend each year for medications, regardless of how many prescriptions you require or how expensive they may be. For millions of seniors who previously faced impossible decisions between paying for medicine or buying groceries, this is far more than a minor adjustment. It has the potential to completely change lives. Next, we need to talk about Social Security and the changes related to cost of living adjustments and long-term funding stability. Social Security has served as the financial foundation of retirement in America since the 1930s. The system was created around a promise: people would work throughout their lives, contribute through payroll taxes, and then receive support during retirement years. But over time, many retirees began feeling uncertain about whether that promise would remain dependable. Each year, Social Security recipients receive a cost of living adjustment known as COLA, which is supposed to help benefits keep pace with inflation. The Social Security Administration reviews inflation data annually and adjusts monthly payments based on those figures. However, older Americans have pointed out a major flaw for years. The formula traditionally used to calculate inflation does not accurately reflect how seniors actually spend their money. The standard index tracks spending patterns of urban workers and clerical employees. It includes categories like transportation, fuel costs, electronics, and work-related expenses. Seniors, however, spend their money differently. Older adults devote far more of their budgets to healthcare, prescription medication, and home assistance services, and those costs often rise faster than most other parts of the economy. The Senior Protection and Care Act directly addresses this issue by encouraging the use of an inflation measurement designed specifically around senior spending habits. That means future Social Security increases may finally begin reflecting the true cost of living for retirees. Over time, that could place hundreds of extra dollars into the pockets of older Americans every year. When someone lives on a fixed income, even relatively small increases can make a huge difference. The legislation also attempts to strengthen Social Security's financial future. Experts have warned for years that the trust fund could face serious pressure during the 2030s, potentially leading to automatic benefit reductions if nothing changed. Few people wanted to see that happen. The bill works to improve the program's stability mainly by raising payroll tax contributions from higher earners. The goal is to reinforce Social Security not only for current retirees, but also for future generations, including children and grandchildren. Third, let's move into nursing home reform, including stronger staffing standards and increased accountability. This portion of the legislation does not receive nearly enough public attention, even though it absolutely deserves it. If you currently have a loved one living in a nursing facility, or if you are thinking ahead about long-term care for yourself or a family member, the quality of these facilities matters tremendously. Unfortunately, abuse and neglect in nursing homes have remained ongoing problems throughout America for many years. Reports from federal health agencies repeatedly showed that large numbers of facilities were cited for major violations, including inadequate staffing, poor cleanliness, medication mistakes, and in the most heartbreaking situations, emotional or physical mistreatment of vulnerable residents. Under the Senior Protection and Care Act, Nursing homes receiving Medicare or Medicaid funding, which includes the overwhelming majority of facilities nationwide, will now face significantly stricter staffing rules. The updated standards require minimum staffing ratios, meaning facilities must maintain a certain number of trained caregivers for each resident. On paper, that might sound like technical bureaucracy, but in reality, it means your parent, spouse, or grandparent is more likely to have a real person available when assistance is needed. Chronic understaffing has contributed to countless preventable tragedies in long-term care centers, and this legislation directly targets that issue. Financial penalties for safety violations are also becoming much tougher. In previous years, fines were often so low that some companies simply treated them as another business expense. That situation is changing. Penalties are now substantially higher, and facilities with repeated violations could ultimately lose access to Medicare and Medicaid funding altogether. For most nursing homes, losing that funding would be financially devastating. This creates a much stronger incentive to follow regulations and provide residents with proper care and dignity. The legislation also introduces new transparency requirements. Nursing homes must now provide easier public access to inspection records, staffing information, and histories of safety violations. That means families researching a facility will have access to genuine information instead of relying only on polished marketing materials handed out during tours. Fourth, we need to spend time discussing elder financial fraud and the protection of personal savings. This issue does not receive nearly enough attention considering how serious it has become. Financial exploitation targeting seniors has grown into a silent national crisis. Every year, older Americans lose billions upon billions of dollars to scammers, fraudulent operators, and financial predators. These scams appear in countless forms. Fake phone calls claiming to come from the IRS, Medicare scams, investment fraud, romance scams, targeting lonely widows or widowers, dishonest contractors who collect deposits and disappear, and even trusted relatives or caregivers secretly draining bank accounts. The FBI has repeatedly identified elder financial exploitation as one of the fastest growing crimes in the country, and many victims never report what happened because they feel embarrassed, overwhelmed, or confused. The Senior Protection and Care Act creates dedicated funding specifically intended to combat these crimes. That means more trained federal investigators focused on identifying and pursuing elder fraud cases, expanded resources for victims, and stronger cooperation among federal agencies, state law enforcement departments, and financial institutions. Banks and credit unions are now encouraged and in many situations required to identify suspicious account activity involving seniors and report possible exploitation through established procedures. This matters enormously because banks are often the first organizations to notice warning signs, including sudden large withdrawals, repeated wire transfers to unfamiliar accounts, or new names unexpectedly added to long-standing accounts. Those patterns can signal abuse, and financial institutions now have both the responsibility and resources to respond appropriately. The legislation also supports public education campaigns aimed directly at older Americans because awareness remains one of the strongest defenses against fraud. Once you understand the common tactics scammers use, you become far less likely to fall victim to them. Fifth, let's discuss housing and the ability to safely remain in the home you love. For many seniors, their home represents not only their biggest financial asset, but also the emotional center of their life. The opportunity to age in place, remaining surrounded by familiar memories, neighbors, and community connections, is something most people deeply value. However, many homes were never designed for later stages of life. Stairs can become dangerous obstacles. Bathrooms without grab bars can quickly turn into accident hazards. Narrow doorways that cannot accommodate walkers or wheelchairs become barriers that threaten independence. The renovations necessary to make a home safer often cost thousands of dollars, money many retirees simply cannot spare. The Senior Protection and Care Act significantly increases support for home modification programs. Through grants and low interest loan opportunities, qualifying seniors may now receive assistance installing ramps, widening doorways, adding walk in showers, improving lighting, and redesigning kitchens for better accessibility. These are not luxury upgrades, they are practical safety improvements that help people remain independent longer and avoid being pushed into care facilities before they are emotionally or physically ready. The legislation also invests in expanding affordable senior housing communities designed around accessibility, healthcare access, and social connection. Many people do not realize that chronic loneliness among older adults can seriously damage health. Research has even compared the health impact of long-term loneliness to smoking 15 cigarettes a day. Housing that keeps seniors socially connected can protect both physical health and emotional well-being. The bill also includes important provisions aimed at improving mental health access for Medicare beneficiaries. Right now, mental health care through Medicare can often feel difficult to access, expensive, and limited. Many therapists avoid accepting Medicare patients because reimbursement rates are too low. In addition, stigma surrounding mental health remains particularly strong among older generations who grew up during times when emotional struggles were rarely discussed openly. The Senior Protection and Care Act attempts to reduce these barriers by increasing reimbursement rates for providers serving Medicare patients and by expanding telehealth options. Seniors living in rural communities or facing mobility challenges may now have improved opportunities to receive counseling from home. Grief, chronic illness, persistent pain, fear of dependence, and isolation are emotional burdens millions of older Americans carry every single day. Seeking support should never be viewed as weakness. It represents wisdom and self-care, and this legislation pushes back against outdated attitudes suggesting otherwise. Seventh, let's focus on caregiver support and the recognition of families working behind the scenes. Caregivers are frequently overlooked in policy discussions, despite the fact that tens of millions of families are affected. Today, an estimated 53 million unpaid family caregivers live in the United States. These are sons, daughters, spouses, siblings, friends, and relatives who take on the enormous responsibility of caring for aging loved ones, often while balancing careers, children, and their own health challenges. The emotional and physical toll can be overwhelming. Caregiver burnout is extremely real. Depression among caregivers is widespread. Historically, these individuals received very little financial assistance, almost no formal instruction, and minimal recognition for the sacrifices they made. The Senior Protection and Care Act attempts to change that reality. New tax credits are available for family caregivers, helping them recover part of the money spent supporting loved ones. The legislation also funds caregiver training programs, so families managing complicated medical situations at home can do so more safely and confidently. In addition, expanded respite care options allow caregivers to take temporary breaks without feeling guilty or afraid they are abandoning responsibilities. A caregiver who receives rest and support is better able to provide quality care, which ultimately improves life for the senior receiving assistance as well. This creates benefits in every direction. Eighth, we should address Medicare expansion involving dental, vision, and hearing care. This section of the legislation has generated major headlines nationwide. Currently, traditional Medicare does not cover routine dental services, regular vision exams, or hearing aids. That leaves a major gap in healthcare coverage because these are not cosmetic or optional concerns. Untreated gum disease has been connected to heart disease, diabetes complications, and cognitive decline. Vision problems increase the likelihood of falls and injuries. Hearing loss that goes untreated is considered one of the strongest modifiable risk factors associated with dementia. The Senior Protection and Care Act makes meaningful progress in these areas. Although full Medicare expansion remains politically debated, the bill includes new subsidies intended to help beneficiaries afford hearing aids, which often cost thousands of dollars. It also introduces pilot programs expanding access to dental care through federally qualified health centers while broadening vision services through community healthcare programs. Advocates hoped for even larger reforms, but many experts still view this as important progress moving in the right direction. Now let's discuss what you should do immediately, because this may be the most important part of the entire video. Please pay close attention. Not every benefit included in this legislation happens automatically. Certain programs require applications. Others may require updating information with Medicare or the Social Security Administration. Some include enrollment windows you absolutely do not want to miss. Begin by contacting your local Social Security office or visiting the official Social Security Administration website. If your state offers a health insurance assistance program, and every state does, consider scheduling an appointment with a Medicare counselor. These services are completely free, unbiased, and specifically designed to help people understand complicated changes exactly like these. There is also an extremely important warning everyone needs to hear. Be very cautious of anyone who calls, texts, emails, or messages you claiming they can help you apply for benefits connected to this legislation in exchange for money or sensitive personal information. Scammers move incredibly quickly. Within days of major legislation passing, fraudulent operators begin creating fake offers designed to steal Medicare numbers, Social Security numbers, and banking information from seniors. Remember this clearly: legitimate government services are free. The Social Security Administration will never pressure you through threatening phone calls demanding immediate action. Medicare representatives will never ask for your credit card information over the phone. If something feels suspicious, hang up immediately, close the website, and contact the official agency directly yourself. Finally, let's end with why this moment truly matters. Think for a moment about your own experiences. Think about standing at a pharmacy counter, deciding which prescriptions you can afford this month because paying for all of them was impossible. Think about watching a parent struggle inside a care facility that lacked enough staff to provide proper attention. Think about receiving a call from your bank regarding a transaction you did not recognize. Think about sitting alone during a quiet afternoon, wondering whether anyone really understood how difficult this stage of life can sometimes become. This legislation is not a perfect solution. No law ever solves every problem overnight. But it does represent a serious and meaningful effort to improve life for older Americans in practical and measurable ways. More importantly, it sends a message. It signals that the challenges facing seniors are finally being recognized after years of many older Americans feeling ignored or invisible. There will still be challenges ahead. Implementing major reforms takes time. Budget battles happen constantly in Washington. Powerful industries that benefited from the previous system, including pharmaceutical corporations, poorly managed nursing home chains, and financial scammers, are unlikely to surrender quietly. They will push back. They will challenge these reforms. They will attempt to weaken the progress that has been made. That is exactly why staying informed and engaged matters so much. The strongest defense any law can have is an educated public that understands what is at risk and refuses to let important protections disappear. Information truly is power.